Okay, Mr. Watson here, and in this video we're going to talk about movement type, specifically joint movements. So, starting with the elbow. So from the previous video we should know that this is a hinge joint. It's uniaxial, so in one plane of movement. So the movements we're getting here are flexion and extension. And flexion is the bending of a joint, meaning we decrease the joint angle. The bones are brought closer together. Okay, and the opposite to that is extension, where that is the straightening of a joint, where the bones are moved apart. You are increasing the joint angle. Okay, so fairly simple to start us off. And we move on to the next hinge joint, which is at the knee. Now, as you can see with the diagram, flexion remains the same. Okay, it's the bending of a joint. We're decreasing the joint angle. We're bringing them bones closer together. Okay, and the extension is the straightening of the leg. So in the diagram, I've just shown you how simply that can be, bending your leg up and returning to a standing position. And in the diagram, I've lifted it up as if I were about to perform a kicking action. And we should know from my previous video that at the knee, we have specific structures such as the patella, the ACL, and things preventing hyperextension. So hyperextension is not something we'll get at the knee joint. If you do, see a doctor. Okay, and then the ankle, so our final hinge joint. And this is where we'll get two terms which are both flexion, but we're not really going to get into that. We have plantar flexion and dorsiflexion. Let's start with dorsiflexion. Dorsiflexion is where we lift the front part of the foot and point our toes towards our knee. Whilst we're doing that, we push the heel downward, and you should be able to see that in the video. This movement is dorsiflexion, and you could also describe this as decreasing the angle of a joint. However, this is where it gets confusing. It is called plantar flexion, and depending where you go and read it, it is flexion. But Cambridge actually do accept one of the descriptions of plantar flexion as extending the joint angle, as if it was extension. Okay, but just to keep it simple, we're going to go with the opposite of what I've wrote for dorsiflexion. And plantar flexion is pointing the front portion of the foot downward, so straightening that foot and lifting the heel upward. Okay, so you have that nice straight motion. So that's dorsiflexion and plantar flexion. Okay, now we start with our pivot joint, and this is the radio-ulnar, which we should know, or a rotation-like action. So the joint where it's encircled by that ligament. Okay, and the movements we have here are supination and pronation. And quite simply, supination is where we turn the palm face up. So the turning of the palm to face upward is supination. And pronation is the opposite. It's turning the palm of the hand face down. So the palm of your hand will be facing the floor. On supination, the palm of your hand will be facing the sky or ceiling. Okay, so pronation and supination happening at the radio-ulnar joint, also uniaxial. Now, further down the arm, at the distal end of the radius and ulnar, we have the wrist joint. And as we know, this is a condyloid joint, and it is biaxial. Okay, so we're going to get a range of movements here. And we're going to start with adduction and abduction. Now, before I play this GIF, you'll notice I'm starting in the anatomical position. And that's very important to understand this, because we adduct the ulna, the little finger side. And what that looks like is you're pointing your little finger towards your thighs. Okay. Abduction is the opposite. Okay. We abduct the radius. Okay. And it will point away. Moving on to extension and flexion before I give you your descriptions. Flexion, as you can see, is the pointing down of the wrist, that forward motion. And extension is either returning it to its normal position, as you could just see there. The movement of it moving further back would be hyperextension. So flexion you have bending down, extension returning it straight, and then decreasing or increasing, I should say, and the angle moving the burns further apart would be if you went for hyperextension to move it further away. I'm now going to give you your descriptions. So adduction towards the midline, okay, so the little finger side when the palm is facing forward in the anatomical position. Abduction away from the midline towards the thumb side when the palm facing forward. Flexion, again, that decrease of angle between bones, hand moves forwards, and extension, the increase in the angle. Okay, so that's our wrist joint, the condyloid biaxial. So then 4 movements we can get at our wrist. Now we move on to the spine, and this slide will happen in a similar format. I'll give you the descriptions afterwards. Okay, so we'll start with a rotation, but we'll start with rotation of the C1 and C2, cervical 1, cervical 2 vertebrae. And here we have rotation of the neck, if you like, but the top of the vertebral column, the cervical section, okay? And it can happen left or right, turning around its long axis. We also have rotation from our gliding joints further down in the thoracic and lumbar region, and this happens from a stationary pelvis, and again left or right we rotate the torso, as you can see in the GIF. We then have flexion and extension. Not only are they at hinge joints, they are also here in our gliding joint. And flexion is forwards, the forward bending of the torso, and extension is the returning to your standing position. Hyperextension would be if you could bend back a little further. Okay. And finally, we have lateral flexion, and this is quite simply, again, from a stationary pelvis where we flex to the side, we bend our torso to the side as so, and it can happen to the left or the right. So again, this might be where you want to pause, but I'll give you your description. So rotation, rotating the torso or the cranium, ribcage, vertebral column toward either the right or left. Lateral flexion, the torso bending in a side direction. Again, all from a stationary pelvis. Flexion is the movement of bending the torso forwards, and extension is returning the torso to its normal position, and hyperextension would be bending your torso further back. Okay, so just probably should, as a reminder, the gliding joint in the vertebral column is multi-axial despite being severely limited. So we do get a range of movements, but they are severely limited. It's certainly not multi-axial like the ball and socket. And then in the C1, C2, the atlantoaxial joint, that is a pivot joint, meaning it's uniaxial and only rotation there, just as a reminder. Moving forward, we go to the shoulder, and now we start with our ball and socket, which are multi-axial joints. So we're going to get a large range of movements here, so please bear with me. I'll try to explain as best as I can. So we'll start with flexion and extension, and flexion of the shoulder is the movement of the arm forwards. Okay, so if you look, the arm moves forwards, and it can go all the way as above and next to your head. Okay, extension would be the returning of the arm to the anatomical position, and hyperextension would be extending that arm out a little further. So we'll see from the side angle here. So flexion, extension, hyperextension. Okay, and as we know, we can also describe it in the other way, such as decreasing and increasing the joint angle respectively, okay, bringing bones closer together, etc., etc. We now have abduction and adduction. Now, if we remember there from the wrist, okay, adduction adding to the midline, abduction moving away from the midline. So abduction would be bringing our arm out to the side, away from the midline, and it can go all the way above the head. Okay, adduction would be the returning, and we'll see here on the video, the returning of the arm to the anatomical position, and the hyper would be you can actually move it a little bit further across. So abduction is away from the midline above our head, and adduction moving back down. And here are your descriptions. So moving the humerus in a forward direction for flexion, extension being the reverse, returning to its neutral position, and hyperextension if you extend it further back. Abduction, the moving of the humerus away from the side of the body, away from the midline, and adduction is the return back to the side, but you can also adduct it a little further. Okay, still with the shoulder. Now we have lateral and medial rotation. So rotating, as we know, rotating on its own axis. Okay, so we have medial rotation, which means rotating towards the midline of the body, turning towards the midline, and lateral rotation is turning away from the midline, which you can see in the video there. Okay. Circumduction, which can often be confused with rotation, circumduction is making a circular movement with your humerus, and the origin up at the shoulder would remain somewhat stable. I'm probably overemphasizing there in the video, but as you can see, a circular motion, movement of that humerus. Okay, so think about you're painting a circle, or you've got your Harry Potter wand. So here's your descriptions. Bone is turning towards the midline, the humerus pivoting on its own long axis. Lateral rotation, the bone is turning away from the midline, pivoting on its own axis. And circumduction, the whole humerus or upper arm is moving in a circular motion. And staying with the shoulder, we have elevation and depression. Now, elevation can be done with one shoulder, as you can see in the picture, or both, as you'll see in the GIF. And what elevation is, the lifting of the shoulders, almost like a shoulder shrug towards your ears. And depression is the returning of your shoulders to the normal position, or you can even drop them a little lower. Okay, a bit like we can hyperextend, etc. So elevation, the lifting of the shoulders, depression, the returning of them to the normal position. We then have horizontal extension and horizontal flexion. Now, these are also known as horizontal abduction and horizontal adduction. We're going to have them as this, okay? And quite simply, what they are is we're working on the horizontal plane. So if we were to put our shoulder into flexion and then move it out to abduction, that is horizontal extension. It's that movement from flexion to abduction along the horizontal plane. Now the opposite is horizontal flexion. We're moving the arm back in towards the midline, and it can even go across our chest. And the fact I've mentioned midline can suggest why they also are known as horizontal abduction and adduction. So there you have horizontal flexion and extension. So just to give you the descriptions, elevation, the shoulders are shrugged, lifted higher. Depression, they return to its normal position, or you can drop them even lower. Horizontal flexion, the arm is held out in abduction and pulled across the chest, as you can see. So the arm here out in abduction, and we're going to pull it across the chest for horizontal flexion. Horizontal extension, where we're in flexion and we move out to abduction. Okay, so there were a lot of movements there at the shoulder. Now moving on to our second ball and socket joint, which is the hip. Okay, now we don't have as many here because while it is a multi-axial joint and a large range of movement, it's not as many at the shoulder. However, it is more stable than the ball and socket joint at the shoulder. So we'll start with flexion and extension, and what you can see in the diagram there is when you flex the hip, you can either do it with a bent leg or straight. In the diagram, I keep my leg bent just for something different, and a bit like the shoulder, flexion is moving the femur in a forward direction. Extension would be returning to its normal position or going even further back, which would be hyperextension. Okay. Abduction and adduction, so we should be getting familiar with these descriptions now. Abduction away from the midline, the femur away, and adduction bringing it back to its normal position, or we can even do that hyper, go a little bit further across. So abduction taking the femur away from the midline, adduction bringing it back. Okay, so flexion, what I put in the description here, you can do it with the lower leg bent or straight, but it's that forward motion, okay, for flexion. Extension is the return of the femur back to its normal position, or you can hyperextend, as I mentioned. Abduction, the moving of the femur away from the medial line, the midline, and adduction, the returning, but you can go a little bit further, and you'll often see that in gymnastics, ballerina, dancing, etc. Okay, now we have medial lateral rotation, and just like the shoulder, they are rotating on its own axis. Okay, so the femur will rotate on its own axis. Lateral rotation, turning away. Medial rotation, turning back in. So away from the midline towards the midline. Circumduction, just like the shoulder, drawing that circular movement with the femur. Okay, so quite quick descriptions there, but we should know this from the shoulder. So here are your descriptions. Okay, and again, to remember, usually the femur, the origin, will remain somewhat stabilized, but I was giving a bit more emphasis in my movements. Okay,